Cardiac auscultation points. So the memory tip here is all pigs eat their meals. APETM in that order. So here in order to remember like aortic is the only one on the right side, whereas the rest all, that is P, E, T and M, are on the left side. So the mnemonic here is aortic has RT in it, so on the right side, whereas all others are on the left side like pulmonic, mitral, tricuspid. Coming to the second intercostal space, you have on the right side and the left side of sternal border. So RT is aortic on the right side and L for pulmonic on the left side. Then comes the third space which has E, that is Erb's point. 3 looks like E. So second and third spaces are done now. Coming to the next space, that is the fourth space which has tricuspid, which is on the left side as already discussed, because only aortic is on the right side, remaining all are on left side. Coming to the last one, mitral, which is in the fifth intercostal space at mid clavicular line. Thank you. Hope this helps you.